Hello everyone, welcome back to Spine Focus. Before we begin, I would recommend you to watch our previous video on Introduction to Cervical Disc Prolapse. Today, we shall discuss about the medical management of an acute cervical disc prolapse. Now here's the good news. About 80 to 85% of patients with an acute soft disc prolapse will get better on their own. This happens because with time, our body starts absorbing the disc material that comes out. The size of the disc material reduces, thereby reducing the pressure on the nerves. With time, there is reduction in the inflammation around the nerves. All of this will reduce the neck pain and the radiating pain to the arms. So it takes about 4 to 6 weeks for the pain to get better on its own. So our goal during this period is to keep the patient comfortable and to relieve the neck and arm pain. So first, let's talk about the steps that you can take when you have an acute attack of a cervical disc prolapse. First, let's talk about the steps that you can take at home when you're suffering from severe neck pain radiating to your arm. When you have severe pain in the neck with radiation to the arm, it is mandatory to take adequate rest. It is not essential to take complete bed rest, but it is better to avoid sitting for a long time, bending forwards and lifting heavy weights. It is essential to maintain a good posture. Make sure you use a soft cervical collar for comfort. Many patients would prefer to keep their neck in a slightly forward flexed position because that will reduce the pressure on the nerves, thereby relieving the pain in the arms. So it is recommended to keep the broader part of the collar, which is usually the front part, at the back of your neck, as shown in the picture. Also, while you're sleeping, it is recommended to keep a small rolled towel behind your neck or even a small pillow behind your neck so that the neck is in a slightly flexed position. It is also advisable to support your arm with the help of a pillow so as to relieve the pain which is radiating to the arm. This can be done while the patient is lying down or sitting. Your doctor would prescribe pain medications and muscle relaxants to keep you comfortable. There are neuropathic pain medications which help to relieve the radiating pain to the arms. Sometimes a short course of steroids are recommended to reduce the inflammation around the nerves. These medicines should be taken under strict medical supervision. As the neck and arm pain starts to get better, it is mandatory to start with exercises to strengthen the neck and the upper back muscles. This would help in regaining the flexibility of your neck and also to prevent such disc prolapses from happening in the future. If the neck and arm pain persists beyond 6 weeks, or if it is affecting your day-to-day activities, or if there are any signs of spinal cord compression, like difficulty in walking, losing balance while you're walking, things start falling from your hand, difficulty in buttoning your shirt, loss of bladder or bowel function, it is essential to consult your nearby spine specialist because in these conditions you may require a surgical procedure to relieve the pressure of your spinal cord or your spinal nerves. In the next video, we shall discuss about the common surgical procedures that are done for an acute cervical disc prolapse. Stay tuned.